Hello everybody, my name is TenBrink, and I'm so bummed that I cannot be there today in person just to personally share my story and how we took the encOR-mis Surgical SmartTrainer technology utilizing Michigan's great resources to where it is today. So apologize for that. But anyway, I am the co-owner of Encoris. We've been in business for 7 years, and what our company does is we work with medical device companies worldwide making medical models and surgical trainers that help them better show and demonstrate their medical device technologies. Before I go into the Smart Trainer and just the steps I've taken, I thought it best just to kind of recap briefly what surgical training is and what surgery is today. So what I have here basically comprises all things generic as far as trainers. They're foam, one-time use, throwaways. They often lack the pathology or disease that clinicians want to train on, and in my world they often involve x-ray. Cadaver training is the primary method of training, and it has severe limitations in the fact that it's biohazardous. Again, it often lacks pathology, and they're very difficult to procure and dispose of. They're expensive, and again, they often involve x-ray. Surgery itself. Back in the day, surgery was very invasive, and you had very large incisions. Today is called MIS, or minimally invasive type surgery, and surgeons are working through a cannulated workspace no bigger than this. It's great technology, however, there's huge problems with the amount of x-ray that's needed. The amount of radiation one is exposed to is exorbitant. So you can see the challenge on a company like us to develop trainers that are more realistic and also safer. Well, 2.5 years ago, I had my light bulb moment at a trade show. I noticed on the floor that all these medical device reps were carrying these iPads, and I was just watching the interaction between sales rep and surgeon as he was showing an animation highlighting the features and benefits of their device, and I'm like, how in the world can I take the technology of that iPad and integrate it into a dummy foam torso to bring about a much more realistic trainer? So with a little bit of excitement, I came back to the shop. I assembled a few body parts, ran it to Best Buy real quick, and then by the end of the day, I had a working, proven concept of my idea. I had shared this with a few of my colleagues out in the medical device field, and they said, wow, TenBrink, you're really onto something. So that was all the motivation I needed to take things to the next step. Conventional means of trying to, source project development just proved just cost prohibitive. $65,000 just to put the concept down onto paper. So anyway, I reached out to my friends at SBDC, and that's the Small Business Development Corporation, who then put me in touch with the awesome folks of Lakeshore Advantage. And that's when things really hit the ground running. Right from the get-go, I was able to get pro bono legal work to do patent research, and also I was able to get grant writing through them. And a few weeks later, I was able to secure $39,000 of the $50,000 available of BAF funding. So that's Business Accelerator Fund. So I was able to develop a working prototype, and for the past 1.5 years, I've been able to take that prototype internationally and throughout the US to trade shows and medical device companies, and the feedback was phenomenal. There were just a few minor setbacks, and what you see here today is prototype 2, and basically what this entails is one of two versions. So this is the all-encompassing trainer, and what I mean by that is that it's integrated with its own Wi-Fi modem, 8 to 10 hour battery life, integrated light system, and camera system. The really neat thing about this surgical smart trainer is the fact that the bone anatomy is modular, meaning we could swap out any type anatomy with pathology for whatever the training calls for. And as you can see, the trainer is highly mobile. So where we are today in the process, we're in phase 3, and basically what we're doing is re-engineering the camera system to more of a C-arm where we get posterior, anterior, and lateral views simultaneously, which can be viewed on any Wi-Fi device And again, I've reached out to the fine folks of MEDC, Michigan Economic Development Corporation, who put me in touch with University of Michigan. And those folks have a program called SCIP, which is the Small Company Innovation Program. And basically what this program involves is taking small companies and marrying them to universities to bring about research, product development, and validation. So product development and validation are the two key things we need to bring this trainer to its finality. So anyway, that's where we are today. The resources that Michigan offers are just amazing. I couldn't be more grateful. And it's a bummer again that I cannot be there for like Q&A and just to hear your stories and just share any advice that I could provide. But anyway, I'm willing to do this for you. If you email me at jtenbrink@encoris.com, I'm willing to just provide whatever advice or steps or just put you in touch with anybody that I feel will help you in your quest to utilize the great resources of Michigan. So thank you so much for this brief opportunity, and really appreciate the opportunity. Thank you. Bye.